Hey everyone, and welcome back. It is our Wednesday midweek edition of Your Lunch Break with me. And there is a lot of talk today about a new tool that was released by the Alabama Department of Public Health. And that is a new color-coded COVID county map. Say that 3 times fast and you will be ready for the weekend. But it's true. This is something that the Alabama Department of Public Health released yesterday at the end of business yesterday to give people a little bit more of an idea about where their county stands in relation to COVID cases and the trend of cases in their county. And although this information has been available publicly for a while now, Dr. Scott Harris of the ADPH said that he thought this would be an easier digestible tool for people to look at and just see visually with the colors where their county lies in the midst of the pandemic. So there's a lot of information on this map. There's different colors that mean different things. So I thought that we would bring back our favorite guest of the week, our own Dennis Pillion, to explain this map a little bit. And we can talk too about, if you have any questions about counties, let us know. We'll show you how you can use this map to find your county and find all the information that you're looking for. And we can answer questions about your county as well. So Dennis, thank you so much for coming to explain this to us. And I'm going to share my screen in just a minute with y'all and let you see the map itself. But Dennis, why don't you give us a little bit of an idea of what we're going to be looking at?
Yeah, so and I think you mentioned one of the most important things that this is a trends map. So this is showing kind of not the total number of cases, not how many people have COVID in a particular county, but kind of how it's been trending over the last few days. And specifically what they're looking at is the 3-day average of the number of new cases in a given county. So if that 3-day average number is higher than it has been, then the county is going to show a higher level of alert. If that average is lower, then the county is going to be one of the lighter colors, the green or the yellow or the orange. And it is, this is a useful tool, but you have to kind of be careful to realize what you're looking at. And one of the advantage or the examples of that Dr. Scott Harris talked about yesterday was Montgomery County, which in the published version of the map, it ended up being yellow. But when Dr. Harris talked about it yesterday, he said Montgomery was actually looking like it was going to be green.
Right.
And Montgomery, they're the second highest to Jefferson County in the total number of cases. But over the last few days, they've had fewer new cases than they had 2 weeks ago. Right.
Right.
They had that huge spike kind of in the early middle part of June. Mm-hmm. And so the Montgomery County's numbers were really high then. They're lower now compared to where they were 2 weeks ago. So that's why they're at less of a level of alert than, say, Madison County, which is red on the map, even though Montgomery County has far more total cases and even far more cases over the last few days. Montgomery County's numbers of new cases are going down, whereas Madison's number of new cases is going up.
Right. And I think I'm going to take it off for just a second and just re-go over with y'all. This is a trend map, like Dennis said. This is not showing the number of cases per county because, like Dennis was just saying, Montgomery, Jefferson County, we are leading those counties are leading the state with the most number of coronavirus cases, but that does not necessarily mean they're going to be red on the map. So that's just something to keep in mind, that this is based on a 3-day trend of cases. So couple of questions getting about cities. This is for counties, not cities directly. So you got to look for your county. So somebody asked about midfields, that would be Jefferson County, and other county questions. So make sure you're looking for your county and not your city. I'm going to put this back on. Let's remember, these are the 4 colors. It's green, orange, red, and yellow. Not in that particular order. Green is what is the lowest risk from the ADPH. That's what they're calling it. And it goes from green, yellow, orange, red. So let's add this back on. So you can see there's a lot of red in this map. There's a decent amount of orange and then less yellow and less green. Our only green counties, it looks like, are Colbert. Let's see. Colbert County, Hale County, Geneva County, Crenshaw County, and I believe that's Lowndes County. I'm having to get close for y'all.
Yeah, that's Lowndes next to Montgomery.
Okay, great. So those are the green counties that the ADPH is calling a low risk. So first, tell us what a green county means, and then we'll get into some of the more red and orange counties.
Yeah. So this, as we keep saying, and we really can't emphasize enough, this is a trends map, and it's not just the magnitude. It's not how much it's dropped, but it's how long the county has been trending in a certain direction. And it's actually, if you go to this website, this dashboard, which is linked in the story that we have there, and there is also a mobile-friendly version if you're trying to look at this on your phone. But so the green counties, you can almost see it on the side there. It shows how many days the 3-day average in that county has been declining. So once that slope of that curve keeps going down day after day after day, then the alert level lessens, from your orange to your yellow to your green. So the counties that are green there have shown a decreasing number of new cases every day, and they've shown that decrease over several days over a longer time frame.
So there is a little tool up here, and I made this, I minimized the map so I could show you the full scale of the website. And if you see at the very top right of your screen, there's a little drop-down menu, and you can select your county. So I had somebody asking about Limestone County. So we can go in here, you scroll through, they're in alphabetical order, and we will pick Limestone County. So then when you pick Limestone County, I'm just using that as an example because somebody asked, you see that you get this yellow bar that goes ahead and tells you it's moderate risk. So you don't have to find it on the county map. And then it's got all this information on the side. Dennis, can you tell us about the black boxes and what that information is?
Yeah, so it's kind of just some yes or no questions, whether they've been declining over the past 14 days, whether they're meeting their testing goals, whether they, and I don't know exactly what those goals are, but they have some kind of a threshold, I think, based on the population and the number of tests that are run. So it says, yes, they're meeting their testing goals. They're declining for 14 days. And then, I can't see the bottom one there, but. Oh,
that's okay. I know we got a little, it says it, visits for COVID-like symptoms declining. Yes.
Okay. So, and then that would be tracking, I believe hospitalizations, to see how that trend is holding up. But so then also on this county level screen, you have those tabs on the bottom of the map. Mm-hmm. And those can provide you some additional information about the county where you're living. There's kind of a broader explanation there, and then also.
So we can click on here, and it says new cases. So you can see this graph right here. This is just, and again, remember we clicked Limestone County. So this says Limestone County at the top, and then it has a graph of the new cases per 100,000 persons.
That's right.
And that's a rate. That's not exactly the number.
Yeah, and that helps adjust for your bigger counties versus your smaller counties. If you don't notice that it's per 100,000 people, you could be thrown off by that. But that just kind of helps level the field for the rural counties versus the counties with large cities in them.
Mm-hmm. And then there's also some interesting tabs here at the bottom where it says percent positive, which is the percent of reported tests that were positive, and that's by the week. So you can see between the week of looks like May the 17th and May the 23rd up until about June the 7th and 13th. That just is a straight line graph, meaning that those tests, there was more percentage positive tests than negative. So that is an interesting look right there. And you can also see the total tested, and that's a bar graph right there. And there's another tab for visits, which is, can you tell us what the visits tab is, Dennis?
So I believe that's hospital visits. Okay. And also on that percent positive, that's a number that a lot of public health experts look at, because basically it kind of shows how many people maybe actually have the disease, but just are not being tested for it. If a lot of the tests you're running are coming back positive, then there's probably people out there who have it who aren't being tested. So there's more infection in the community. So that's kind of a guide that people use to look at and say, well, are we just seeing more cases because we're testing more people, or are we seeing more cases because there are more sick people out there? And
Right.
if you have a high percentage of positive tests, that means you're testing more of the people who have obvious symptoms, who really probably have it, and you're not kind of randomly testing healthy people or people who may just have mild symptoms and that sort of thing.
So we'll go back to this map. Somebody asked about Russell County. So we will do this one more time and show you how to do it if you're looking for your specific county. So this is a toggled zoom. Obviously, it's a little hard to zoom in and out there, but I can go on the top and I will find, and this is the top right corner, we'll go down to Russell County. And then, so we get a bright red bar at the top, says Russell County, very high risk. And then it gives you, again, this information on the left. It says that is the percent declining? No. The testing goals met? Yes. What does all that mean? Declining 1 to 6 days, Dennis, what does that mean?
So it looks like I said earlier, they are basing these color-coded alert levels on the trend, so the 3-day average of new cases per day, and how long that number has either been going up or going down. So it says on this one, declining 1 to 6 days. So maybe it's been going down a little bit, but its peak on that graph that goes up and down, its peak was 1 to 6 days ago. So they're still in a very high risk area according to the chart, and you can kind of see that there, right? The average dips down a little bit right at the end of the graph, but it's still pretty high. What they're looking for to get that green alert to take it back down is to have that number go down for several days in a row and have the number of cases be decreasing over time.
So that is something too. I'm going to answer a couple questions really quickly. This is not a map that we made. First of all, this is not an AL.com map or anything like that. This is from the Alabama Department of Public Health, and it's a state. The state is handling this and using the state's data for this. We're just trying to show y'all how to use it and answer any questions that you might have, because it can be a little confusing to understand the different, all the different things that are involved in this map. Like we said, you've got the things on the side and the tabs on the bottom. So we're just trying to get that information out to you, but this is not a map that we created by any means. A question that I think is really interesting, because I thought the same thing. This is from Linda. And Linda is saying, I'm not surprised Baldwin County is in the highest risk in the red category. And that is interesting because, Linda, I kind of had the same thought, because we've seen in the maps where we talk about the case numbers, not the trends, but just the case numbers, that Baldwin has not been as high as a lot of other counties. But here, and I'll zoom in on this map a little bit, and you can see that Baldwin is in the red. And that is, again, the very high risk category, which we haven't really seen or heard about that happening in Baldwin. So Dennis, can you elaborate at all on that? I'll pull it up and get the more information while you're talking.
Yeah, if you can just pull up the number of new cases there, and like we said, obviously Baldwin does not have nearly as many total cases as Mobile next door, but as you can see right there, the average number of cases has been going up, and it has been going up over the last several days. So that's why they're showing there as the highest level alert. And if you can zoom in on the number there of if you hover over it, it shows you the actual number. And that's why it's, to compare from county to county, it says the 3-day average per 100,000 people is 5.5. Well, yeah, there are other counties that have much, much higher 3-day averages than that. But it's higher. Baldwin County is higher than it used to be. So they're getting that red designation because the number is increasing, because it's going up. And if you wanted to compare that, so that was 5.5 and Baldwin was the latest one per 100,000.
Yeah, that was 5.5.
And if you want to pull up Montgomery now just to compare it to, Montgomery's number, I believe, is in about 25 per 100,000. So even though Montgomery is yellow and Baldwin is red, Montgomery is having, 5 times more
Right.
cases over the past 3 days. So
That's really interesting, and that you say that Montgomery and other counties like Montgomery, maybe they have a lower risk color, but they still their cases are still multiplied by those smaller counties and by those counties that are maybe even a worse color.
yeah, and if you kind of look at the Montgomery County peak there, but I can't. Back in kind of earlier in June, we're in July now. Hey, but if you look at how high that peak was, the reason that Montgomery is now in the lesser phase of alert is because their numbers have been declining from that peak. But it's, as Dr. Harris said, it is not an all clear. It is not trying to say that you can go about your business in Montgomery County without having to worry about it. They still, have very high levels of infection and very high levels of positive tests. They're just not as high as they used to be.
Right. A couple of questions too that we're getting about the governor in her press conference yesterday. The governor did say that she was not, at least at this point, going to require a mask ordinance statewide. She said that she believed that would be nearly impossible to enforce. But she and Dr. Scott Harris both did recommend wearing masks. And I had a quote, I don't have it in front of me, but she said something along the lines of, "For goodness sake, y'all just put on a mask." And I thought that was telling that the governor and the Alabama Department of Public Health officer were saying that, maybe not requiring it, but they were encouraging it.
Yeah, and one of the other things that Dr. Harris said yesterday in that press conference when he was talking is that currently for people 65 and older in Alabama who are tested positive for COVID. 11% of them, about 1 in 9, have died. So that's not a good survival rate. That's not that's pretty alarming to me. That you can, if you're over 65 and you get COVID, there's a 1 in 9 chance that you won't survive. Mm-hmm. And particularly with this disease where, younger, healthier people who are, the kind now that are going out in public, that are having parties in Tuscaloosa, what have you, they can go out and they could potentially be infected, and they might not even know it. They might have no symptoms. They might have very mild symptoms, but then, they go home and visit mom or grandma, and they have a very different experience, and that person, there's a lot of transmission like that going on from people who probably don't realize they have it, may not have any symptoms beyond what we would just consider maybe a regular cold or flu, but then, they transmit that disease to somebody else, and it becomes a totally different situation.
Somebody made a comment about how she needed glasses to see that. And you and I both, I know that that's kind of small when we pull it on there, but you can get that data and you can get that map for yourself. It is linked in Dennis's story, which is in these comments. Click that story and there's a link that'll take you straight to that map. And again, it looks the same as it did on my screen, where you can pick your county from the drop-down menu on the top right, or you can look at the map as a whole. So that is available in Dennis's story and on the Alabama Department of Public Health website. That is, I wish I could make it bigger on my side, but unfortunately, maybe there's a way and I just don't know it. But that's as big as I could make it. I'm sorry. And Michael, you're welcome. We're trying to explain how this data works and how you can interpret it, because something I've said on here several times is numbers are definitely, I was never a math person. And sometimes when you just see a list of numbers and the data just spelled out like that, it's a little bit harder to understand for some people. And so, including myself. So sometimes when you are able, somebody can walk you through it and all the different tabs and information, it can be a little bit more easy to digest. So if you have questions, please let us know. We can walk you through how to do it again. And also, there were some other questions about the virus and the impact that it's had across Alabama and the nation, but particularly in Alabama. Yesterday at this press conference, we saw one representative and one mayor in Alabama take the stage at the Governor Ivey press conference and say, this virus is real. It has affected me and it's affected my family. And Dennis, do you think that a lot of these counties that, again, are the colors may be a little bit misleading to people, or could be if you don't understand how to interpret that data. Do you think that the local leaders speaking out about this is having any impact on those trends?
Well, I hope so. We have certainly seen, I guess, some evolving thought, which we don't often see in Alabama politics. Kind of cities, and Montgomery is one prime example where a city councilor votes against the mask ordinance one day, and then the next day changes course and says this is something that we need to do. And face masks. The data keeps showing that is a good way. It's not going to necessarily trap every particle of the virus. It's not going to be 100% effective, but it can definitely reduce the chances. If a person who is infected, if they're wearing a face mask, then they are much less likely to spread it to somebody else. And that's just the kind of common sense precaution that I think more and more people are realizing just makes a lot of sense. It's not like I said, for those people who may be asymptomatic or maybe mildly symptomatic, they're feeling fine themselves, but then they're potentially just spreading the virus around and giving it to more people. And face masks is a good way to, not eliminate that, not completely eliminate the risk, but reduce the risk. And I think people are starting to recognize that reducing the risk of spreading this is a pretty good thing, whether that's for your health, for other people's health, for the economy. The less this disease spreads, the better all of those things are going to be. So.
And that was something that the governor, Dr. Scott Harris, and the representative and mayor who were present yesterday all said. They said that the masks were important. And again, the representative whose sister had died, and that was, I believe, Dexter Grimsley, his sister had died of coronavirus earlier this year. And the Greenville mayor, Dexter McClendon, he had said that his wife and his mother had all battled coronavirus. So two people that were affected by the virus and definitely had severe, definitely at least for the representative, had severe repercussions. And I know that the Greenville mayor said that his wife had a pretty bad case of it, and luckily they recovered. But again, the governor did really strongly encourage those face masks, but did say that she was not at this time going to create a statewide order. Couple of quick questions. Anna, does the map include nursing home deaths? This map is just a trend map. It's not showing us the exact number of cases or number of deaths per county.
Yes, so I will say this map doesn't show that, but there is a different dashboard on the Alabama Department of Public Health website that does show that. So you can find that on the ADPH website.
Got it. But this, again, Anna, so you can find that on the website, but this map is not going to show that. Another question that I don't know the answer to, you might, Dennis, is from Leslie. She says, for people that have tested positive and had a retest 14 or more days after, and their second test is positive again, does that second test add another positive?
I do not know. I will have to check on that.
That's a really good question, Leslie, because I know a lot of people that have tested positive, to know that they have beat the virus, they need to take another test to get that negative. So that's a really good point, Leslie. We'll check on that and give you a comment back. Now, again, I will give you one more look at this map. I'll zoom back in on the county part. But if you want to see this for yourself, you can go to the Alabama Department of Public Health website. And that is also linked in a story here that we've put in the comments for you. But just keep in mind that these green, yellow, red color codes are definitely, you need to look at the numbers a little bit before deciding where you believe that you should be able to go or not. And something that, Dennis, I'll let you end on here is that green may not necessarily mean go in this case.
Yeah, absolutely. And they, as you can see here on the screen, on the right side of the screen, they have a very detailed explanation about what all of the different color classifications mean, and a little bit more. It might take you a little bit of time to read that and really figure out what this map is showing you. We've tried to explain it here as best we can, but they have the full explanation there on the right side of that screen, and then also some recommendations for for what people should do if their county is in any given category. So in those, if you want to scroll down there, the recommendations for the green category are not do nothing. This is still obviously, in Lowndes County there, you're still, surrounded by red counties, and then with Montgomery right there on the right. So even though Lowndes is in green, just me personally, I would still be very cautious. I would still take a lot of precautions, as I'm doing currently in Jefferson County, just to keep myself and my family safe.
So again, if you have any questions about this, please let us know. We will be happy to answer them for you and to break it down a little bit if that helps you. You can find all this information on the Alabama Department of Public Health website. Also linked in the story on AL.com that is linked in the comment thread here. You can get all that information. And there were a couple of questions that I know that we will check on and let you know. But thank you so much, Dennis, for helping us break this down and understand this data a little bit more. Thank you, everybody, for watching and hanging out with us today. Tomorrow at 11 a.m., we will have on Fairhope Mayor Karen Wilson and to answer some of your coronavirus and reopening questions. So any questions you have for the mayor, please let me know, and we will see you tomorrow.
Thank you.